What are the benefits of direct pay? Find out in Medical Economics Pulse.
So I've noticed that I'm more relaxed, that I'm able to have conversations that I couldn't have before, especially about behavior change. And I also find that patients are more willing to share more of their story, to ask more questions, and get engaged in their own health care.
The modern physician's practice is besieged by the burdens of practicing medicine under today's insurance model. Because of administrative burdens, prior authorizations, and value-based pay, many doctors say the challenges of traditional practice makes it more difficult to treat their patients effectively and contributes to physician burnout. For these reasons, many physicians have a growing interest in direct pay or concierge practice models, which avoid the insurance hassles and allow physicians to spend more time with patients. What are the benefits of these models, and what are the challenges? Today, we sat down with Dr. David B. Wright, an internist who runs his own direct pay practice, to discuss what physicians need to know about these models. Okay, to start off, can you describe what is a direct pay practice? What does that mean?
A direct pay practice is where the patient has a direct agreement with the doctor to pay cash for the doctor's services, as opposed to an insurance-based practice where the insurance company is really the middleman to pay for some of those expenses.
So we hear all the time about the challenges of a traditional medical practice, how it leaves physicians and patients with not enough time to spend with each other. It leads to physician burnout, and it leads to all these kinds of challenges that medical economics is covering all the time. Can you talk a little bit about why the traditional medical practice contributes to these challenges, and then also some of the benefits of direct pay?
That's a great question. So the traditional model, which I was in for 35 years of my practice, demands that you see enough patients to meet all of your expenses. And office staff is expensive, rent is expensive, reimbursements have been declining, and you end up spending less time with the patient so that you can see more patients. The challenge also is compounded because then you have insurance forms to fill out, pre-authorizations, just a whole host of paperwork that overwhelms you. And so the average doctor spends less than half of their time actually taking care of patients. So we're seeing more patients spending less time with them, but spending more time with the computer, with paperwork, and things that really aren't why we got into medicine in the first place.
So you mentioned you had been practicing in a traditional practice and you've changed your practice model. Can you talk a little bit about your model and how it's different from a traditional medical practice?
My model is a direct pay practice. Some would call it a concierge practice. And all that means is that the patients know ahead of time that when they see me, they know what their services will cost them. We can have a monthly agreement. We can have an annual agreement. I even have hourly consultative fees. So patients know exactly what their expense is going to be and allows them to choose what services they want to get from me. And then as I set up testing, that can be run through their insurance, or they can pay out of pocket for that as well, especially if it's for testing that might not be covered by their traditional insurance. So it really gives me the flexibility to spend more time because I can actually charge for my time. And I can give them the high value that that time is worth and focus on the problems that they came in to see me for.
In your experience, running the practice model that you're running now, what so far has been the benefits to both you and to your patients?
Oh, I love that question. So the benefits for me, and these are things that I didn't realize when I just made the switch from insurance model into a direct pay model, but I realized that I'm much more relaxed during the day. I don't have the flurry of patients. And again, I did traditional insurance-based practice for 35 years. I know what that feels like. And I enjoyed it, quite honestly. I wasn't burnt out. That's not why I changed. I changed because I wanted to spend more time with each patient. So I've noticed that I'm more relaxed, that I'm able to have conversations that I couldn't have before, especially about behavior change. And I also find that patients are more willing to share more of their story, to ask more questions, and get engaged in their own health care, which I think all doctors want that. Well, our favorite patients are the ones that are engaged and follow the advice that we dispense. And in my practice now, everybody that comes to me is buying value. And so I get to spend that time. It's not a luxury, it's a necessity.
What are some of the challenges to a direct pay practice in terms of both, sort of making that transition and also just like some of the things that maybe you didn't think would come, or that you're experiencing that maybe you weren't experiencing under the traditional model?
There certainly are challenges to the direct pay model. The first one is recruiting patients. And I hate that word recruiting, but I think everybody knows that we do have to attract patients that are willing to invest in their health. And that's not going to be everybody. It could be. The care that I provide doesn't have to be expensive, but it is intensive. So you do have to find patients that are looking for value. You have to get your story out, and that's something that we're not trained in doing. Our reputation is supposed to speak for us. So-and-so is a good doctor. That's who I go to. And that's word of mouth is great. But if you're doing direct pay, you really have to craft a different message. And that's something I wasn't trained in. So filling your panel of patients, whatever that might be, is a challenge. And so you have to get better at social media. You have to get better at a website that tells maybe a slightly different story than the traditional website. You have to figure out what your pay schedule is going to be. What is it worth, and what is the right price point, for an example. You don't have as much staff. You don't need as much staff. About 40% of my former practice overhead was based on the back office, the insurance and pre-certification office. You have none of those people. It's really me and one other person that is running the practice. So I've had to wear a few other hats, but I've got a little more time. So I do some things that I didn't do before, but I've got the time to do that. You do have to prepare for that transition and to let your patients know that you're going into a new practice model. Give them a chance to be a part of that, and then provide for a transition of their care for the folks that have chosen not to follow you into the direct pay practice.
So in your practice, as you have it today, how is a patient visit different than it was in your traditional practice? Sort of like, kind of describe a little bit like how your patient visits are now, and also specifically, because what we hear about a lot from doctors is that they have trouble spending enough time with patients with chronic conditions. So can you talk a little bit about how sort of treating chronic conditions and patient visits in general are sort of different now as they were?
Yeah, the patient visit is very different in my current practice. So before, with the crush of patients that you're seeing, it's very transactional. What's wrong today, basically? How are you today? How can I help you today? What prescriptions do you need refilled? And just not much time for that deeper dive conversation. We would have those conversations. Behavior change is very important in keeping people healthy. So we'd have those, but they'd be very abbreviated. Now my visits actually start out, I will tell a new patient, first of all, this is going to be a very different visit from what you've probably ever had in a doctor's office. I just let them know that up front. And I also tell them, you'll actually do most of the talking, and I'm going to do most of the listening, because I want to understand what your concerns are and what you're trying to accomplish. Now, both of those things are assumed in the regular medical visit. Why are you here? I care about you. I want to know what you want to accomplish. But they're assumed and they're not defined. And so I ask patients questions such as, I understand that you're concerned about having a heart attack. Why are you concerned about that? What are you fearing? What are you uncertain about? What would you like to know more about? And uncovering more about what do they care about. So in my current practice, I am trying to be interested in everything that they're concerned about. And I'm trying to understand their perspective. Whereas in my former life, it was more how interesting can I make my conversation so that they'll do what I hope that they do? And am I saying it in a way that they will understand me? Flip the script. Seek to understand. Seek to uncover those motivations. And I had a nurse train me in this question. She said, Dr. Wright, you're used to asking people what's the matter with you. What you need to ask instead is what matters to you. Wow. Yes, we need to know what's wrong. We need to ask medical information, but to ask what matters to you, what motivates you, who are the important people in your life. And I'll ask a patient that's concerned about heart disease, who in your life would be affected the most were you to have a heart attack or a stroke? And that's when you hear what's important, why they care about it, why would they want to be engaged in making a whole set of decisions that involve behavior change. So we start out that way, and then I go through a traditional medical history. Yes, I need that information. But then we segue into, here's what we found out, here's what it means, here's some things that you could consider. Which ones of those are you willing to start talking about and learning more about? So it's really a patient-directed visit as opposed to a physician-directed visit. I'm more the guide of the conversation than the expert in the room telling them what they need to be doing. So that's at the first visit. The follow-up visits, I will usually walk into the room and ask this question: what are we celebrating today? And the first time I ask that to somebody, they look at me like, well, you mean my birthday or my anniversary? Or I said, no. You made some great plans last time that you were here for your health. What have you noticed that's different? Let's celebrate that. And so we start off reinforcing the things that they decided to do, that they committed to do, and how that is showing up in their life. And then again, we still go on into the traditional medical interaction. So those are pretty cataclysmic changes in the way that I am practicing medicine. And the fun is that patients really do engage in that. They really do make behavior change, and they really do enjoy a healthier life despite their chronic conditions.
You touched on this a little bit before about marketing and sort of reaching out, the recruiting process. So what strategies have you used to sort of let prospective patients know that you're there and what you provide, and in terms of social media, website, all those things that you had previously mentioned. Can you talk a little bit about actual strategies you've used?
Yeah, it really is important to get your story out there and to let people know what you're doing and how is it different? How is your practice different from everybody else's practice that they have to choose from? It's a buying decision, and they don't know what you're offering unless you can describe that. So yes, I've used Facebook, for example, and post informative articles there, some patient testimonials, things of that nature. Website the same way, provide education, provide information about what I do that is different. Focus on that our strategy is to help you prevent heart disease and stroke and diabetes. So start with a message that will let people know, ooh, maybe I want to know more. What I didn't do so well in the early years was I was trying to make it all about me. Here's what I do. Well, the experts, and for your viewers that really want to take a deeper dive, what I would recommend is that you read a book called Story Brand by Donald Miller. It came out a few years ago, and since then I've changed the way that I do this. He's got a website too, and I don't know what that is, but if you Google Story Brand, you can see it. But Story Brand is about how do we make our customer, which in our case is our patient, the hero of their own story. And so they are the Luke Skywalker of their own Star Wars adventure, and I'm the Yoda. And I'm not the hero of the story, but Luke needed Yoda, right, to get to where he wanted to get. And so what you want to do is highlight that for patients that are concerned about whatever it is that your practice is focusing on, we are your guide. We have the solution. We have a unique way of doing it. Here are some of the ways that we go about doing that. But make the biggest advice I would say is make the patient the hero. Make it clear that you're a guide, and a guide in a way that is different from the other choices that are out there.
To finish up, what sort of final advice would you have for physicians who are maybe contemplating, they're in the traditional practice and they're thinking about doing something different? Just what are some just thoughts you have on how to think through that decision? How do you know when it's the right thing for you to do? Like, how do you know when it's time to transition? I guess that's ultimately my question.
Oh, that's a great question. And I think it boils down to taking a look at your current practice, whatever it is, and is it giving you the satisfaction that you hoped for in your medical practice? Doctors, for the most part, went into medicine for wonderful reasons. We love the science. We love applying the science. We have a compassion for people, and we want to see people do better. That's why we got into it. So we love that. Your current practice model might be conspiring against you, where you've lost the joy of that because, quite frankly, you don't have the time to spend with the patients. It is the in and out, and you're just doing transactional medicine. Nothing wrong with that. And let me be clear, that sort of practice I'm not denigrating that at all. But if it's stealing your joy, if you go into work feeling exhausted, emotionally, mentally, physically, if your batteries aren't getting recharged by the weekend, if you're feeling cynical, if you're being sarcastic with your staff and your patients, if you're feeling depressed, those are all signs of burnout. Burnout is a signal that you're not satisfied with your practice of medicine. Now, having said all that, that's not why I left my practice. I left because I knew I couldn't focus on patients and the conditions that I wanted to focus on in a traditional insurance model. But getting back to how to make that decision, if you have some of the symptoms of burnout, maybe it's your practice model. And maybe it's the two things. Number one, the medical focus of your practice, you might want to change that. And that might imply or might entail a change in the business model. So the business model doesn't need to come first. That's not the magic answer to, especially if you're feeling burnt out. That's not the magic answer. The answer really is in what do I want my medical focus to be, and then choose a medical practice model that fits that. I can share that before I made a transition to the concierge model, one of my solutions was, because I wanted to give more care and more time to patients with chronic conditions, was to use my nurse practitioners and give them more authority and more education and more responsibility for different parts of the practice so that I could spend more time on some of the things that gave me joy. And so trying to find out what you want differently in your medical career opens up the possibility of what you might be able to do differently, which might end up in a direct pay practice.